Kane Chambers served 13 years in the Army. An incident during training caused PTSD, leading him to seek treatment at Toowong Private Hospital.
Without Toowong, yeah, I don't know, I'd be in a very bad place or not alive, I think, yeah. Bit of a sad thought, but lucky for Toowong, I'm still here.
In 2022, he spent 3 months as an inpatient before joining the hospital's 12-week outpatient program for veterans and first responders with PTSD.
I think for all veterans, it's a place that any veteran with mental health needs should be going. The support they give is excellent. I couldn't rate the place highly enough, to be honest.
Earlier this year, he relapsed and immediately returned to Toowong.
I'm a much happier person now than I was before I went in, and healthier as well. I don't drink alcohol anymore, get to the gym more often, apart from the physical injuries, but mentally I'm a much more happy person.
But that's support that will no longer be available. After failing to find a buyer, the family-owned hospital went into voluntary administration in mid-May. With no viable option to keep the doors open, the hospital will close tomorrow after nearly 5 decades in operation.
It is unique as a hospital. It's a small independent private hospital, and as such it was able to be quite nimble and introduce important advances in our field. It's supported the programs we run for PTSD, for defence personnel, but also for first responders.
Dr. Joshua Geffen is packing up after 25 years as a psychiatrist at Toowong. The facility cares for about 3,000 patients a year.
That means I have to ask colleagues who are also overburdened to take on the care of a patient they don't know and who doesn't know them. And that runs the risk of having serious health consequences for patients.
He says Toowong has been hamstrung by limited government rebates for psychiatrists working in hospitals.
People are admitted in crisis at the lowest point in their life, and you can't really compensate for the reduced income to hospital work by giving them a big gap of $5,000 or $8,000 at the end of a course of treatment, because all you do is put them under greater stress.
The CEO of the Private Hospitals Association says Toowong has also been crippled by the soaring cost of providing treatment as private health insurers refused to pay market rates.
We're aware of another 8 hospitals that are at risk, imminent risk of closing. Now, clearly there's something wrong in that equation, and what's wrong is the health insurance industry.
The closure comes after the demise of Healthscope, which runs 37 facilities across the country and went into receivership last month. Healthscope's management cited underfunding by private health insurers as one of the main causes for collapse.
Over the last 3 years, the private health insurance industry has been engaged in rapacious profiteering. They've made the biggest profits in the history of their industry. Their management fees have increased by a massive 18% to reap another $3.5 billion extra from people's premiums. And all the while, they've shortchanged private hospitals to the tune of more than $1 billion a year.
It's simply not true. Health fund payments to hospitals have increased by 8% over the last 12 months, which is well above inflation. And if you track back what health funds have been paying hospitals, it's followed health inflation almost exactly for the last 10 years, correcting for the pandemic.
Increases not passed on as stated, the Private Hospitals Association said, because of complicated and prolonged contractual arrangements.
We've got one major insurer who refused to renegotiate with the hospital for 13 months. That means the hospital was on earlier rates that weren't keeping pace with the cost that it was incurring at the time. Another major health insurance outfit who simply refused to contract with the hospital at all.
Following the announcement that Toowong Hospital would close, the Prime Minister told local radio the Health Minister is looking into it.
Quite clearly, the health insurers need to pay additional money for the private health care that's provided, and that is creating an issue across the board.
The minister threatened 2 months ago that he gave the health insurers 3 months to get their house in order and return better prices to hospitals. I can report from my members that they are not seeing any change.
In a statement, Health Minister Mark Butler told 7:30 he had called for insurers to urgently increase the amount they pay out for hospital services, and after assessing insurers in coming weeks, he will look at what regulatory actions he can take. Kerry Zernier is among the last inpatients at Toowong Private Hospital. Toowong has kept her going as she battled a major depressive disorder over the past 30 years.
There is that worry, there's that anxiety, stress, like, you know, where are we going? What are we going to be given? Can we get into anywhere?
She says the care she needs is not available in the public system.
You have to be really unwell and really in a different stage, and I don't ever want to have to get to that stage that I can then access public health.
When we lose 58 beds out of the private sector in one city, that has quite a major impact. Public hospital emergency departments are already very busy, and public hospital psychiatry units are already full. There really isn't a place for them to go easily.
The State Health Minister wouldn't be drawn when asked whether his government might offer a last-minute financial bailout.
There's no direct impact to Queensland Health from the upcoming closure of the Toowong Private. The patients at Toowong Private tend to be the less acute, the lower acuity patients there. Often many of them are therefore day patients. In Queensland Health, we tend to take the more complex and more difficult cases.
While Toowong does provide treatment for acute cases, the diverse range of care is precisely why Kerry and Kane wish Toowong would remain open.
I would love for someone to save it, yeah, definitely. I would like to know that if I had to go back into a hospital, it'd be back into Toowong. Once it goes, I don't know how I feel, yeah. Yeah, I don't know. No words, really, yeah.
And if that story's raised any issues for you, you can call Lifeline on 13 11 14.